Here's a word you don't hear every day. It means exactly what you might think it means, the opposite of illness. It's a movement that is catching on all over the country among doctors, nurses, and others concerned with medical care. Wellness is really the ultimate in something called self-care, in which patients are taught to diagnose common illnesses and, where possible, to treat themselves. More than that, it is a positive approach to health, what one doctor calls recognizing that health is not simply the absence of disease.
Is Teresa Rose. She's a former nurse who turned to self-care after suffering for years with painful muscle inflammation. Unable to find a cure with regular doctors and specialists, Teresa gave up traditional medicine and entered a program of self-care known as wellness. This is a new and developing concept that takes self-care to its farthest point. Noted for his work in this field, Dr. John Travis established a wellness program soon after finishing medical studies at Tufts and Johns Hopkins universities. Can you give me a definition of wellness?
It's recognizing that there's more to life than the absence of sickness. The health is simply not the absence of disease. It's an ongoing dynamic state of growth. Just because you aren't sick, you don't have any symptoms, and you could go get a checkup and get a clean bill of health, doesn't mean that you're well. It doesn't mean that you're going to prevent disease further down the line.
I had been in and out of the Cleveland Clinic. I had seen numerous specialists in various areas, and I just was so tired and so fed up being in so much pain. I would give you a ballpark figure of about $35,000 over the last 9 years in medical care.
Traditional medical care?
Yes, and had achieved nothing.
152, 3.
Giulio Esposti joined self-care for the same reasons. He's an executive with a major West Coast firm. For years, he suffered from constant headaches and physical pain. Doctors told him it was due to stress in his work. But any test or x-ray doctors administered to Giulio proved negative. Like Teresa, Giulio says he didn't find relief until he entered a program called Wellness. Now, is what you're into a substitute practice of medicine?
No, absolutely not. It is an adjunct to and quite different from the practice of medicine. We don't treat, diagnose, or prescribe. Our role is to help the person discover why they're sick.
Travis does this by looking at a person's whole lifestyle, their diet, work habits, and physical activities. What solved Giulio's illness problems was biofeedback.
As the tone gets lower, you're warming, and you just raised your hand temperature 1 degree.
Biofeedback basically is an electronic device used to measure the amount of tension or stress in a person's body. After several sessions, Giulio learned not only how to relieve his pain, but also how to handle stressful situations at work.
I was getting headaches about 3 times a week.
This is before you started going to the wellness center.
That's true.
And how often do you have headaches now?
I guess I get about once a month now.
But when you first started going to the wellness center, did you say to yourself, or did someone say to you, that's a crazy thing to do?
A few people in my life said, what is it? Have you checked out the credentials, and where were they educated, and, you know, all of those sort of questions. However, at that point, I really felt that I had spent all those years going to your credentialed individuals. And so when I found someone who was willing to talk it out with me, that was pretty receptive to me. Not tell me what was wrong with me, but help me to find out myself.
Revived interest in self-care is reaching the health profession. Twice a year now, health professionals, surgeons, nurses, therapists, and others meet with Dr. Travis to learn methods of wellness which they can use for themselves as well as for their patients. Critics of the wellness movement particularly, they say, well, what would you expect in Marin County, California? It's another one of those kooky California. Why can't it? That's what the critics say to me. Yes.
Well, I don't like labels, especially with all the latest publicity on cults in the San Francisco area. And I think that wellness as a concept doesn't need to have a culture or subculture added to it.
A doctor from Southern California, I'm talking now about a physician, she's very critical of the wellness movement, said, Mr. Rather, what you're dealing with is a middle-class cult.
That's anti the whole concept of wellness, to follow blindly. We are not cheap, and the whole thing we're learning here is to take responsibility for ourselves, to question, and to use what fits for me.
And in wellness, you are the leader. You're your own guru, and you're the perfect person that is trying to make your life better and more full.
If more and more people become involved in wellness and indeed do take care of themselves,